Welcome to today's episode. I have the great pleasure of being with Dr. Artur Zembowicz. Dr. Artur Zembowicz, MD, PhD, is the founder, medical director, and principal consultant at Dermatopathology Consultations, LLC, and the founder of dermpedia.org. He is also a professor of anatomic and clinical pathology at Tufts Medical School and a senior dermatopathology consultant at Leahy Clinic in Burlington, Massachusetts. He has multiple interests, including inflammatory dermatopathology, especially vasculitis, vasculopathies, and drug eruptions, as well as melanocytic and adnexal tumors. He trained in anatomic pathology at the Brigham and Women's Hospital in Boston, a teaching hospital of Harvard Medical School. Dr. Zembowicz learned the second opinion consultation trade from Dr. Martin Mim and launched his independent practice, Dermatopathology Consultations, LLC, which serves more than 200 pathology organizations and receives 5,000 to 6,000 cases per year. He is committed to education and founded dermpedia.org, a dermatopathology education platform that provides CME. He is also involved in the WHO classification of skin tumors, both the 4th and 5th editions, and serves as the dermatopathology consultant to the National Cancer Institute. He lives in Belmont, Massachusetts with his wife, Margaret, a pediatric anesthesiologist, and they have 2 adult children. His hobbies include hiking, skiing, and racing dinghies. Welcome to Artur.
Thank you for inviting me.
I'm so excited to talk to you about various subjects and wide-ranging things. My first question to you would be, what role do you think soft skills like emotional intelligence and having a growth mindset have played in your career?
That's kind of an interesting question because I'm not sure I understand what emotional intelligence is. What is it? Define it for me.
So there are lots of different definitions. True researchers in emotional intelligence have one definition, and then I think there's the popular media type of definition. The way I define emotional intelligence is simply that you can name your emotions, how you're feeling, and also then regulate them. You recognize that you're getting angry and you regulate it and help the situation to become better. At least for ourselves, we can try to name what we're feeling. A big problem I've learned is I thought I was just really remedial in emotional intelligence, but I've learned through Brene Brown, she did this recent book called Atlas of the Heart, where she defines close to 90 emotions or something. But she says that really most adults can only name 3 emotions. And so imagine if you can only name 3 versus if you're more sophisticated and you can name like 90. It's the same as like in dermatopathology where maybe I only know 3 diagnoses at first, but then I can become more sophisticated and say, oh, it's not just melanoma, it's desmoplastic melanoma or something like that. So what do you think?
It looks like it's something that I wish I had more. I asked you that question just to maybe buy some time to think about this because we intuitively, I think, know what the meaning is on the kind of a basic level. Emotional intelligence, I think it's huge. I think it was certainly had big impacts on my success and ability to navigate the world of academia and business and personal life. I think it's very important. Most of us, we take interest when maybe our skill set is not as great. And at some point we realize that we want to improve. I'm very fortunate to be a grandfather, and I'm observing that now 9-month-old baby as he develops. And I get a sense of certain kind of ability, the energy, willingness, desire to learn. Some people are born with certain set and are fortunate to have a lot of that emotional intelligence. I don't feel that I was that way. I thought this was a little bit of my handicap, but I had to improve.
Yeah. So how did you improve?
By observation, right? But also I have a certain kind of a skill set by playing to my strengths. I think that's the key thing, right? We're born with a certain set of basic skills, right? I think the key is to play to your strengths and then identify those weaknesses and maybe address them, soften your edge, learn when you get burned on your emotions or something hurts you, hurts your career. And often you can point it not to a technical skill, but your inability, let's say, to coexist with your colleagues, to make sure that your mentors or superiors respect you or see you that way. And a lot of stuff is preparation. I race dinghies, I race sailboats, and you win the race on the shore before the race by preparing yourself, by knowing what the weather is going to be, by knowing your competition and positioning yourself in a relationship to the fleet, right? You want to start first because you get your first win. And I think in many situations in a career, that's very important. It's so important how you start that first day on the job, the first month. It's so important because it sets your race.
Yes. I love your comments. I agree with them when you're talking about your grandchild. Congratulations, by the way. Babies, right? They're exploring. They don't really know anything. So they keep having to learn. They touch something. It's fun. They touch it again. They touch something. The parent says no, or the grandparent says no, they don't. And as you mentioned in life, in our career, when things don't go well, then we can learn from that, especially if, as you say, emotional intelligence, I do think is a skill. Just like you said, with racing dinghies, how you set yourself up is very important. Okay, great. So is there something that you wish you had known earlier in your career?
I learned a lot related to this topic. It's very important to handle your emotions in a way that don't interfere with your work, with your relationship with your colleagues, with your family. I was very fortunate to have very good mentors. Mentorship is so important, to have people that you can call or talk to when you have a problem or have an issue or you want to learn. It's more difficult for men to do that. But I was very fortunate to have someone I would call and say, Stan, I have this issue here. What should I do? And his answer was always, oh, Arthur, do nothing. Wait it out. So I would say that healing properties of time, very important. That saved me from writing many angry emails or getting engaged in conversations that had no chance of succeeding. And I think that would be one kind of advice I would give to other people. You have problems, you have feelings, just wait it out.
I love that. I really do love that.
What I've learned, you asked me that question, be aware of midlife crisis in the kind of mid-40s, late 40s, just a tough period emotionally for folks. It was for me, when you're in 40s, you question your life, you question your success. I see that in people that I'm mentoring, that it's around that time when maybe they feel that there's this burnout, there's that kind of a sense, even people who are super successful, they don't feel that way, right? You have this feeling that if you didn't make it to be next Bill Gates, you failed, right?
Yes. Sometimes I have said, I'm having a midlife crisis. To me, just as you said, you've gotten to a certain place in your life, whether you consider that as having achieved what you wanted or whether it's that you haven't achieved what you wanted. So in either case, I think both cases, you're sort of like, am I okay with where I am? And sometimes even though you've gotten everything that you had ever dreamed of, you can still feel like something's missing. And conversely, even if maybe you haven't even achieved like a third of what you might have wanted when you were whatever age or dreaming at whatever age, you are totally fine with where you are.
Being comfortable with yourself, being satisfied with yourself. And I think that comes in 50s. There's this life cycle, and I think 50s are great.
It sounds like this sort of midlife crisis is a necessary thing.
It's baked in, I think. You can't avoid it.
Would your recommendation on getting through that to also use time? Don't be too hard on yourself.
I think what helps is mentorship, is having someone to talk to. And that's harder for men.
So earlier with the midlife crisis comment, you did mention burnout and how to navigate through that. Do you have advice on how to thrive and confront burnout?
To be honest, I've never really felt burnout defined as, oh, I cannot go to work or I'm tired of work. Because now I've always kept control over what I do through being entrepreneurial. That really helps for sure. If you're always pursuing a new venture, a new project, or a new hobby, I think that really helps. In this new world, you have fewer opportunities to deal with burnout through your work. So I think the solution for physicians is going to be to play to your strengths outside of work, like a family, hobbies, sports. And I think that's where newer generation is going. I think there'll be more physicians that will treat their work as just work. I just go there to make money and then find more satisfaction outside of work.
I like what you said about being entrepreneurial. I think that goes along with that growth mindset that I mentioned earlier, like that mindset of a 9-month-old baby, that if you're always exploring and being open to the many possibilities that are out there, you have options. And so even though the system might be a certain way, you realize that you have options and you don't feel trapped. I think that's important.
Soft skills, you said, or emotional intelligence for new things. If you want to start new things, what is very helpful is to be prepared to fail. And that's very difficult for many people. This audacity to try. And I think I was very fortunate myself that I have no really fear of failure. If I fail, it really doesn't bother me.
You've always been like that?
Yeah. I see many very bright students or trainees, they never fail. I think that is something good to have that experience too.
Yeah, I agree. Yes, the audacity of trying, of putting something out there. That's great. Our conversation so far, I think, relates to you being a consultant dermatopathologist, that you give second opinions or maybe sometimes third or fourth opinions on difficult cases. I'm sure that as a consultant, you see sometimes either true errors where it's really the wrong diagnosis, or just you don't quite agree with how someone else diagnosed a certain case. Do you have thoughts on how you deal with that?
How I deal with that? First of all, I do all my best not to disagree. I have this concept of reasonable diagnosis, right? If I saw the case for the first time and no one ever saw it, I would sign it out in a certain way. But if a case already carries a diagnosis, I take that into consideration and I modify my diagnosis if it's reasonable. When I do my Dermpedia workshops, for instance, with Phil Lebois, who's also one of the top consultants, we think the same way. We're not as dogmatic as people might think and not forcing our opinions, because most of the opinions are reasonable. The umbrella of reasonable diagnosis is quite broad. Most of the time, it's not that impactful on patients or on management. We know that experts disagree, right?
Yeah, there's a range of what might be a reasonable diagnosis. There is quite an umbrella, to use your term, of what's reasonable. And to pretend or act there isn't, I agree with you. I think that's wrong. But I guess just to push this a little bit, what I struggle with is when it's still a reasonable diagnosis, what someone else said, but I strongly feel I have a certain interpretation and it would really make a difference for the patient, one versus the other. That's where I find it a little difficult, because I can recognize that the prior diagnosis is reasonable and I don't know what the right answer is.
Yeah, that's a little bit different situation. It's very rare, fortunately.
Okay.
It's a very rare situation, actually. But then if it's reasonable by wrong, then you have to provide the right. Because you want to push that, you don't want to harm the patient, but at the same time, you want to help to bring that conflict into some sort of conclusion. So you want to acknowledge the challenging situation or difficult interpretation, emphasize that it's very reasonable, but you still can offer maybe a different perspective, or try to soften the impression that the wrong diagnosis was wrong. I also want to bring the wrong diagnosis under the fold.
Yeah. Sounds good. Do you have any final thoughts?
No, it's just fun chatting with you, and really think it's very interesting because we rarely have opportunity to exchange our kind of experience. Because I'm actually very much interested in sharing experience. There's this concept of evidence-based medicine, right? That sounds so logical, but still a big chunk of medicine is not evidence-based, it's judgment. So I have interest in judgment, right? And how you share that, how you teach people that, right? That making judgments is a kind of different skill.
Yeah. Thank you so much for doing this with me. It's been really fun.
Yeah, thanks. That was great fun.